Hi, everyone. Thank you so much for joining me. Today, we're going to be talking about prolonged grief disorder and the brief grief questionnaire. So, grief is a complex experience that simultaneously isolates and unites individuals. No two grief journeys are the same, and feelings associated with grief, such as sadness, anger, guilt, and self reproach, can heighten feelings of isolation. However, uniquely singular one may feel in their journey, grief remains a universal human experience that connects individuals. Discussions about grief, historically reserved for intimate spaces, have shifted closer to the foreground in a COVID-19 world plagued with mass loss and collective mourning. The difficult subject of grief has arrived into the mainstream lexicon. A global reckoning with grief, what it is and how to live with it, is a universal human experience, is gaining more critical examination, including within the field of mental health. As of March 2022, prolonged grief disorder was included in the text revision of the Diagnostic and Statistical Manual of Mental Disorders. That is the DSM 5, and it is now present in the DSM 5 TR. Although the majority of adults that experience grief as a natural response to loss will notice symptoms decrease over the course of a year, approximately 1 in 10 adults will experience intense, persistent, enduring, and disabling grief that interferes with daily life. Defined as prolonged grief disorder, adults experiencing the loss of a loved one at least 1 year prior to the diagnosis live with at least 3 symptoms as outlined by the American Psychological Association. Symptoms of the disorder can include identity disruption, marked sense of disbelief about the death, feeling that life is meaningless, and intense loneliness. So the brief grief questionnaire um, is what we will be exploring today. Several assessment measures, including self-report and clinician-rated questionnaires, can be used to assess specific grief symptoms and track progress in treatment over time. The purpose of the brief grief questionnaire is to provide a screening for complicated grief. The brief grief questionnaire was developed within the context of research that surveyed a sample of Project Liberty crisis counseling recipients. The norm was 149, approximately a year and a half after the terrorist attacks on September 11th, 2001, to determine the proportion of respondents who screened positive for complicated grief, a recently identified condition marked by symptoms of continuing separation distress and accompanying bereavement-related traumatic distress. Respondents indicated whether they knew anyone who was killed in the attacks. If so, they were asked 5 questions to screen for complicated grief. The authors chose items for 2 proposed criteria sets that they judged appropriate for a screening instrument. Both criteria sets include intrusive images of the deceased and avoidance of reminders of loss. They included trouble accepting the death and feeling numb and detached. The current authors of the brief grief questionnaire included a global question about overall interference with ongoing life. Answers were rated on a 3-point scale. The 5 items were not tested for validity or reliability. So alternatives beyond traditional assessment. Grief is a normal and adaptive reaction. You don't need to be an expert that can treat grief, just a human being that uses lived experience and interpersonal skills to support individuals. It is crucial to avoid pathologizing. Psychological first aid can be a useful framework to use to bolster self-care, including developing a personal well-being plan. A common sense approach to build coping resources, not in-depth psychological therapy, are 3 steps for adapted grief context when we're thinking about first aid. Number 1 for the 3-step first aid, ensure basic needs are met. Number 2, ensure social support is in place. And number 3, develop a self-care plan that helps to A, work through loss, and B, re-engage with valued and well-being enhancing activities. And just a note on the first aid 3-step approach. Those approaches are not strictly evidence-based, but are useful in a variety of contexts where you wish to take a non-pathologizing approach to people who have been exposed to a particular traumatic or stressful situation that could turn into prolonged grief. So the critique of BGQ, the Brief Grief Questionnaire, is that when compared to the inventory of complicated grief, the Brief Grief Questionnaire is not able to identify the kind of depth and breadth that the inventory of complicated grief can capture. Brief grief is an adequate assessment for capturing a snapshot of client's grief experience. And that brief insight can indicate if a client may need further support with their grief. The use of psychological first aid elements rather than a traditional assessment can truly be a real benefit to implementing, as we have discussed, that the aim in grief work is truly not to pathologize, as grief is a natural occurrence. Thank you so much for being with me today to talk about prolonged grief disorder and the Brief Grief Questionnaire. Have a wonderful day.